So in this segment, we're going to be talking about coronavirus basically spiking in, around the world, but mainly in Europe. I'm going to sneeze in a minute, I think. Nope, it's gone. Great stuff. I was talking to my friend Clara, who will hopefully be on the show at some point, and hopefully should be on for December. I've got Alice coming on next week, hopefully though. So big up that, subscribe for that. But yeah, getting back onto the actual video. You see the Czech Republic, that's where Clara is from, and Carol, shouts at Carol, or she calls him Charles for some reason, but yeah, shouts at Carol. They're spiking massively, and she said it was in part because people got really relaxed, didn't take it seriously. Also, the fact is that, because they dealt with the first wave really well here, this is their first wave, and the second wave probably starting here probably here, you could argue, in July. Because they dealt with it so well, people didn't actually take it seriously. Similar things happened in Germany, with a lot of people not taking it seriously because the first wave wasn't that bad. What I would recommend to them is, look at the UK and look at the US. When you don't take this thing seriously, it will decimate. Coronavirus is like a sprained ankle, boy. It ain't something to be played with, in the words of Drake. So there's Wales there. Wales is interesting because they're going through a fire break at the moment. So we'll monitor Wales as well. We'll keep it on the list. Because France is way up there, and Germany is climbing. Same with the UK. But the thing is, France and Germany have gone into national lockdowns. The UK has not, and that'll be important for a few different reasons. But you can see Sweden's climbing too. Their death rate is very low in Sweden, so that's quite interesting to look at. But if we go to our main article here, or with several articles as always, so nearly 100,000 people catching the virus every day. A new study. So the study by Imperial College London says the pace of the epidemic is accelerating and estimates the number of people infected is now doubling every 9 days. The authors say we are at a critical stage and something has to change. France and Germany have turned to forms of lockdown to control the virus. Community Secretary Robert Jenrick told BBC Breakfast that the government wanted to try to avoid having a national blanket approach to coronavirus restrictions in England, where a national 3-tier alert system is in place. But the thing is, that's not enough. The lockdowns aren't enough. You need to fix test and trace. You have to fix that. Otherwise, doing lockdowns is fine, but if you can't figure out who's got the virus, which people are asymptomatic, this stuff will help save the NHS time. And it will buy us time. A lockdown will buy us time to fix test and trace, but unless they fix it somehow, some miracle draw, it's just not happening. We don't have a plan today to do a full national lockdown, he said, adding such a move would be destructive to people's lives and livelihoods and broader health and well-being. Do you know what's also dangerous to all those things? Coronavirus. A national fire break lockdown in Wales, whilst Northern Ireland has tightened restrictions, including closing schools, and Scotland will later confirm details of its new tiered alert system. I don't think Scotland has come out with it yet. You got Jonathan Ashworth saying, the Prime Minister what did he say? Called the Prime Minister to hold a news conference to outline the steps he will now take to control the virus and save lives. And the thing is, the government hasn't actually outlined a plan of how to get out of being a tier 3 or a tier 2 place. So there's that. They haven't actually told us what the numbers have to be to get in or get out of certain tiers. So that's pretty embarrassing. It's just a mess. It's a mess at the moment. So we go to our next article. This is lockdowns return as Europe confronts a second wave here. So 2 of Europe's biggest economies are reinstating some form of a national lockdown as the continent confronts a surge in coronavirus cases and deaths. From Friday, people in France, so that's tomorrow, people in France will only be able to leave home for essential work or medical reasons. President Emmanuel Macron said the country risks being overwhelmed by a second wave that will no doubt will be harder than the first. Meanwhile, Germany is imposing less severe national lockdown because they don't have to impose a hugely severe lockdown because their coronavirus numbers are way better than most of Europe's at the moment. So we'll talk about Germany's one in a minute. France but they include restaurants, bars, gyms and theatres. Angela Merkel said. This is Germany. We'll talk about that in a minute. Infections are sharply rising across Europe, including the UK, which is on Wednesday announced 310 new deaths and 24,701 cases. And so if we go to our next article, next piece, this is from Katja Adler. This is about Germany. So Angela Merkel has just announced a month-long partial lockdown nationwide. Schools and shops to stay open, but bars, restaurants and leisure facilities must close. Merkel spoke after meeting regional leaders. This partial lockdown is an attempt to stop patchy regional response. Under new measures, private gatherings will be limited to members of 2 households with a maximum of 10 people. And so, obviously, in the UK, I think you can have any number of households, but it's a maximum of 6 people. Obviously, the Germans don't have to be as aggressive in their lockdown, purely because their numbers are not that bad compared to ours. And that way, by them stemming the flow of the coronavirus now, it will save them having to do more aggressive full-on lockdowns for longer later on. So Merkel's asked people not to travel unless absolutely necessary. Hotels in Germany will be closed to tourists, and this is probably the best thing that the Germans have done when it comes to the lockdown. Angela Merkel said there will be a new financial support for businesses affected. She said the government will pay smaller companies up to 75% of their income from November last year, and that's great news for any small business owners in Germany. I'm not sure what that means for bigger businesses, but up to 75% of their income, that's phenomenal. And that's going to help German businesses stay afloat. The reason, I don't know why the UK isn't doing similar, but what Rishi Sunak has done post, the first furlough scheme was a joke. The business loans were a joke. Some of the grants were a joke, and the man's a fraud. So this guy here is quite funny. It will never work without a tier system, some traffic light systems, and a Nando's menu as a policy. That's what real leadership looks like. That's pretty funny. Sorry, I need humour. This is painful. So, what else? The NHS is short £1 billion. So the NHS short of over £1 billion for COVID second wave and onset of winter. So exclusive hospitals in England each have up to 20 million less than they need to cope in the coming months. So the NHS has been given the way they phrase this is weird. The NHS has been given in excess of £1 billion less than it needs. They should just say that the NHS is short £1 billion. To deal with second wave and winter. I don't know why they've named it like this, but this is an interesting tweet from Rachel Clark. She's a doctor, I believe. The government told us they would give the NHS whatever it needs to care for patients with COVID. Turns out that was a lie. 22 billion to outsource private sector mates, no problem. 1 billion for the NHS, get lost. It's the patients who suffer, and she's right. And if we actually look at the ICU units per capita, this is from 2012, but this is the last time a comprehensive study has been done. And this is the one that a lot of different websites are using, including Forbes and Politico. So if we look at these numbers of ICU units, so you got Germany is at 29 ICU units per 100,000 people. So that's how it works here. And if you look at where the Czech Republic is, they've got 11.6 per 100,000 people. But if you look at the UK, we only have 6.6. We have a very, very low amount. And what that means is when this second wave hits hard and when hospitals have to ration care, it means that ICU units and doctors, or not the ICU units obviously, but the doctors and the nurses will have to figure out who gets to get the life-saving care and who doesn't. And so essentially what you're going to do is have a lot more doctors and nurses with PTSD and other mental health problems, purely because essentially they're going to be choosing who lives and who dies, and it's not their fault. The reason they have to do this is because we didn't take a second wave seriously, and also we don't have the NHS isn't strong enough when it comes to ICU units or in general. We already just covered that the NHS is £1 billion short for this winter and the second wave. That's been happening for for about 10 years now. So I'm not surprised. The NHS is in the state. This is what happens when you underfund something. It goes through cuts, and it just doesn't run as effectively as it should do. If we look at this, so this is the number Forbes has referenced as well. So you got 6.6 ICU units per 100,000 people, and that's pretty much the same here as the one Politico have written. You can see a lot of other countries have a lot more ICU units than we do. So when coronavirus starts putting people in hospitals, as it is doing, if we look at where's deaths? If we look at deaths, there's going to be a lot of people in ICU units, and eventually it's going to get to a point where there's not enough ICU units, and that's when we're going to get even more problems than we have now, and that's what scares me. We already talked about. See if we can load up this article quickly. NHS staff in the midst of terrifying mental health crisis with 2 million days lost due to mental health illnesses. And so we'll talk about this article separately. That will be linked to this article, I guess, and another nurse shortage video. But what we can see from this is, a lot of countries are struggling right now, and we're in a very weak position because of the NHS being weakened by successive prime ministers, Cameron, May, and Bojo the Wonder Clown. and so we're in a very precarious position here. And there are multiple reasons why the government doesn't want to go into a national lockdown, but I feel like eventually it is going to happen. A lot more regions are going to go into tier 2 and tier 3 lockdowns, and essentially I think it will be a national lockdown, just not in name. So I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.